We always forget spiritual wellness. I just wanted to share two short anecdotes of the work we do. Because the moment you say alternative medicine, you create enemies. Because it is like, if you are in the room, I will not be there. It is either you or me. So then you go to the next evolution, which is complementary medicine, where it says you and me. So you or me became you and me, and integrative medicine is us. And that is what Professor Vigilani has done at AIMS. Today, what we see in integrative medicine is the hard work he did. As a young researcher, his 10-day program that he would devise, where they watched videos, they listened to talks, they did practices, they had dietetics. That is the comprehensive approach of yoga chikitsa, not just asanas chikitsa. So by taking this into our hospital, we are actually following what WHO calls TCI medicine, traditional, complementary and integrative medicine. And two examples. There was a patient of psoriasis, which you know is a skin condition. And we know that there is, along with psychoneuroimmunology and psychoneuroendocrinology, a new term, psychodermatology. And we know that skin conditions flare up whenever you are stressed. So this patient was not responsive to medical treatment. They were giving, the dermatology doctors were treating her, she was not responding. And they kept on changing the drug and trying so many things. And one day she just became so irritated, she asked one of the young doctors, "Can't you give me something else?" And yoga department is next door to dermatology in those days. So they said, "Why don't you go to yoga?" That is how it came. The referral wasn't like maybe yoga will help. Just get rid of the person, go to yoga. She came for the yoga and 2 weeks later became responsive to the medication. Now see what has happened by combining yoga with modern medicine. A drug-resistant psoriasis patient becomes drug responsive. So yoga is not a threat to modern medicine. It is an able ally. And this is the message we give. Another work we did, published in Indian Journal of Psychiatry, was on depression, adding yoga as an adjuvant therapy. And what happens is, at the end, you give medicine, depression comes down. You add yoga with the medicine, depression comes down a bit more, which is okay. But what we found on sub-analysis is the patients who had depression often also have anxiety. And that anxiety required another drug, whereas those who were getting the yoga, the anxiety also came down. So you were managing depression, and the anxiety was also getting managed without adding another drug. Now, why do people stop medication in chronic conditions? Two reasons. One is cost. Because if you have to take that same medicine twice a day for your whole life, you will become a pauper. Very simple. So people stop the medication because of cost. The second, side effects. You ask any patient, why did you stop the treatment? Side effect or cost? Now, if you can add yoga, which is non-pharmacological treatment, that reduces stress, enables the relaxation response, which facilitates what is today being increasingly called the healing response. You facilitate the healing, you can actually reduce the drug. When you reduce the drug, I'm not saying even go off the drug, I'm even saying reduce the drug. The moment you reduce the drug, you are dealing with much less side effects and much more cost-effective healing modality. So this integration of yoga with modern medicine is a godsend, both for the patients and for our healthcare system.
Thank you. We'll have to have another discussion another day on mind-body medicine. So if there are any questions,